Why might a doctor recommend urinary diversion for bladder treatment? Have you ever wondered why a doctor might suggest urinary diversion for bladder treatment? This recommendation often comes into play when the bladder can no longer perform its essential functions. One of the most common reasons for this is bladder cancer, which may lead to the need for a surgical procedure called cystectomy, where the bladder is entirely removed. In such cases, urinary diversion becomes necessary to create a new pathway for urine to leave the body. Another reason for recommending urinary diversion is when there is a blockage or obstruction in the urinary tract. This can happen due to strictures, tumors, or severe urinary stones that prevent normal urine flow. If left untreated, these conditions can cause pressure buildup and potentially harm the kidneys. Sometimes, damage to the bladder can occur from radiation therapy or other cancer treatments. These treatments may impair the bladder's ability to store or expel urine effectively. In addition to cancer-related issues, there are non-cancerous conditions that can affect bladder function. For instance, nerve damage from birth defects like spina bifida, spinal cord injuries, multiple sclerosis, chronic inflammation such as interstitial cystitis, or even trauma to the bladder can necessitate urinary diversion. Advanced cancers in the pelvic region may also require urinary diversion as part of extensive surgical procedures. This helps manage urine flow when the bladder is compromised. There are different types of urinary diversion, tailored to meet individual patient needs. One common method is the ileal conduit, where a segment of the intestine is used to create a channel connecting the ureters to a stoma on the abdominal wall. This allows urine to drain into an external pouch. Another option is the continent urinary reservoir, which is a pouch made from intestine that stores urine inside the body. Patients can empty it periodically using a catheter. Lastly, there is new bladder reconstruction, where a new bladder is formed from intestinal tissue and connected to the urethra, allowing for urination similar to normal function. After the surgery, patients receive education on how to care for their urinary diversion. This includes stoma care, pouch management, hygiene practices, and lifestyle adjustments to maintain bladder health and prevent complications. In summary, urinary diversion is recommended when the bladder is removed or unable to function due to cancer, injury, obstruction, or other serious conditions. It provides an alternative route for urine to exit the body, helping to preserve kidney function and improve quality of life. Always consult with healthcare professionals for personalized medical advice and thorough post-operative care to manage life with a urinary diversion effectively.